This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. A 75-year-old lady who has a dense Brunescent cataract is posted for surgery. Let me take you through the strategies which I'm going to use in such a patient. Now, our primary concern is avoiding any stress during nucleus division, whether chopping or sculpting. And second thing would be to protect the corneal endothelium while emulsification of these fragments. So with the advent of the torsional energy, it's much more easier to cut through the nucleus because of its enormous cutting ability. And thankfully, even with this cutting energy which we have, the amount of heat which is generated at the wound is lesser and there is a lesser chance of wound burn. As a result of this, I have come back to the 4-quadrant divide and conquer technique in these denser cataracts because it's much more easier and stress-free to divide the nucleus into the 4 quadrants. And let's see some of the principles which we follow in such a case. The first prerequisite is to have an adequately large Rhexis. So in this case, you can see I have performed a Rhexis which is more than 6 mm. I should say it's 6 or 6.5 mm. It's preferable to have such a large Rhexis simply because when you're doing nucleus manipulation inside the bag, there are lesser likelihood or chances of stressing the Rhexis margin and then inadvertently pushing any stress in the zonules. So it's worthwhile to have a bigger Rhexis, especially in such cases. Hydrodissection has to be very minimal because there is always a risk of a capsule blowout. These capsules are very thin, and another advantage of having a bigger Rhexis is that there is an easy let out of the fluid and the lesser likelihood of the pressure building in the capsule bag. The nucleus rotation is confirmed. Now is the time to perform the emulsification. The superficial epinucleus is taken care of. Let me pause here and let me show you some modifications which I've done. The tip is slightly exposed longer in this case because I can get a deeper trench and also a narrower trench. The longer exposure helps me to get to the base of the posterior plate much more easily, and because the sleeve is away, I don't have to make a wider trench to reach the posterior plate. Let us look at the settings here. Many people use wrong settings for sculpting. So let me show you what settings I'm using here. The power is set at continuous torsional. It is set at 90%. The flow rate is 14 and the vacuum is 120. The most common mistake which I have seen people committing is that they use a very high flow rate and high vacuum, which is not ideal for sculpting. The main intention of sculpting is to shave through the nucleus to create trenches, and in that, Phaco power is the most important parameter. We don't want any attractability or hold. That's the reason why flow rate and vacuum don't have a significant role. Their role is to just clear off all the debris which is being shaved off by the sculpting. So this principle we need to understand. If we have this, we'll have better control in sculpting and you'll not be afraid of creating longer trenches. The second important factor which I keep stressing is to use your left hand to stabilize the nucleus. So when we trench, we don't want any stress to be going on to the capsule bag. And in these cases, when the nucleus is slightly mobile, we may end up pushing the nucleus. And when you push the nucleus, it's going to cause stress on the bag. So I would prefer always to stabilize the nucleus with my second instrument. This is the chopper here while I'm doing the sculpting. Please observe that when I'm doing sculpting, the nucleus is very stable, it's not jumping around, and I'm going full throttle with my energy. I want the ultrasound to do the job rather than the mechanical pushing. There are some stages where there is some jitter in the nucleus, it can be moving around. Maybe this much power is still not good enough, but supporting with the left hand does come in handy in such situations. The nucleus is rotated 90 degrees. The sculpting is again done, and every time the new trench is created, it is much more deeper than the preceding one. The nucleus is then rotated, the same sculpting is done, and the trenches are deepened. As we go beyond the central core of the nucleus, I feel that we are hitting the hardest part of the nucleus because while moving the tip, I can feel more resistance, just suggesting that the nucleus is much more denser in this posterior aspect. I'm also observing the changes in the color here. As we can see, it goes from being a bright yellow or brown to going slightly darker. We can see this patch which has become darker. The nucleus is rotated, and then again the lighter portion is sculpted. Eventually I start seeing some of the darker portions. This is an indication that maybe I have reached about 90% depth, and now is the time to attempt cracking. The important prerequisite is to ensure that both the instruments are held as deep as possible in the trench. Literally, I would tell that the instrument should be touching the posterior plate when we're attempting the lateral separation maneuver. As the lateral separation maneuver is being done, I realized that this screw is not still deep enough. I thought I should have done a little bit more deeper, but as you go deeper, you become scared also that you shouldn't go and eat up the posterior capsule as well. The nucleus is rotated. Same principle to be followed. The tip and the chopper, both of them are right on the posterior plate as the lateral separation is being done. Now this helps us to crack the nucleus effortlessly. The same process is repeated until we have got these 4 quadrants. So now is the time to emulsify each of these fragments. Again, the parameters are changed to the quadrant removal mode. I'm using 700 vacuum, 60 flow rate. Bottle height is kept at 100 centimeters, and the power is kept 60% continuous torsional. The first fragment is held with the probe and pulled out of the bag, and then it is being emulsified. Now this is a stage of the surgery where the endothelial damage can happen. So using the power judiciously, and the second instrument always should be on top of the Phaco tip. So this would act as a shield and prevent some of the fragments from flying around and hitting the endothelium. Now our goal is to minimize the turbulence. This is possible by using the Phaco power judiciously and avoiding an excess usage. If you use a large amount of energy, the nuclear fragments will be thrust away from the probe, and there is always a risk of them flying around and hitting the endothelium. The first fragment is done with. Now look at how the second fragment is maneuvered out. The chopper pushes the anterior portion of the nucleus laterally so that the posterior apical portion comes more anteriorly. Then the Phaco tip goes and grabs it and gets it into the central safe zone. And now the emulsification is being done. Again, being slow is the key here. Now I can emulsify these fragments in a jiffy. If I use excessive power, these masks can be destroyed and emulsified very quickly, but that would induce a lot of turbulence. Time to put in some more OVD. The nucleus is then maneuvered, and then the same process of emulsification is continued. I have changed my second instrument to a Sinskey hook now, but it does the same job of acting as a shield or guard as it is being placed on top of the Phaco tip. Last fragment, again OVD goes in, and the emulsification is done in a very controlled manner. So in this case, nucleus division was the toughest part, and you require to have the right strategy and loads of patience to do it well. And you'll be surprised that in spite of using a significant amount of energy, the corneas would be very clear the next post-op day. Time to remove the cortex. Very little cortex is there, but these are tough ones. They're very sticky. Hydro polishing is a good way to deal with them. They'll be sticking onto the posterior capsule, and it really tests your patience. Time to place in the lens. I'm doing a hydro implantation in this case. It's a single piece hydrophobic lens. The lens is dialed in place. OBD both in front and behind the lens is aspirated out. The ports are hydrated. That's it, the case is done. Now these are the first day post-op pictures. Cornea is clear. And the message from this video is, in spite of having a very dense and a brown cataract, if you follow the right strategies and you're a little bit patient, getting clear corneas on the first post-op day is not a very difficult task to achieve. So that was it. Thank you for watching and hope you found this helpful.